Doctor, who cares? I'm happy. No, I'm not.
What makes you passionate about your job? Why you are waking up every morning and be an orthodontist?
I like the
orthodontist.
smile on the patient. I like when I see a patient happy with the teeth at the end after a long treatment, let's say, and that you change the life of the patient, you change their smile, and you can see like there's a big impact on their lives. So this feelings makes me work really with pleasure. And so many cases, I'm only waiting for the last minute to see the smile on the patient when they finish the treatment. Even the tears of happiness and tears of joy is touching me a lot at the end. And that's the most important thing for me. I enjoy doing orthodontics. It's not about the money, it's not about anything else, but I love it. Even if I have money, I will keep working, maybe not for so many days, but I will keep working because I love it.
I know you have a different specialization as well, because you specialize yourself in occlusion and TMJ. Can you explain better what is it, and also how you combine orthodontics with this other specialization?
It's true. Yeah, I have my postgraduate training program in TMJ and occlusion, but at the beginning, as an orthodontist, we don't only straight teeth. Orthodontists usually will straight the teeth, and also we are trying to make a normal function for the teeth with a normal bite. And of course, some patients, they have symptoms of pain in the TMJ or the muscles tension, and there's a part of it coming from the teeth and the bite. And that's why it makes me like I have to focus more on this part. And I start to do my postgraduate program. Even while I'm working, I was used to travel like every month for 1 week to do my postgraduate program, because I need to combine both the function and aesthetics together. So we are not looking at the aesthetics, just the alignment. We have to look at the aesthetics, the function, the relations between the teeth, between the two jaws, and the health of the TMJ at the same time. So to make these three together to be in harmony, it's not an easy job. It's a hard work. And so many times you can have a patient who have like straight teeth, but they have pain. And when you go deep in the diagnostics and to look and the cause, you can see really like a different bite, and the patient is trying to compensate this by putting the teeth together with muscle tension. Then you have to deprogram everything and go with a long trip sometimes to fix this. So to make the bite in harmony with the aesthetic, it really needs a lot of effort and a lot of work. And you can't do it just like simply but what we have got in orthodontics. You need to have much more deeper information to get it. And that's why I have done that specialty. And so I combine this information with what we have with orthodontics to trying to give the best outcome for the patient. And by the way, I'm Virgo, so this is a problem for me. I try to keep things perfect as much as I can, but there's nothing perfect, as Dr. Ajay mentioned.
My brother too, so I understand.
And it's annoying for the patient, by the way. It's annoying for the patient. Sometimes the patient are so happy with the treatment, and I'm telling them, no, you still need like few months to fix the bite. I said, doctor, who cares? I'm happy. No, I'm not. Your bite is not right. You have to do this. You have to do this. And the treatment takes longer sometimes. And the patient comes back to you, doctor, you told me 1.5 years. Now it's been almost 2 years. We didn't finish. Yeah, the bite is not right. I have to fix the bite. So this thing's annoying for the patient. Or midlines difference, like 1 millimeter of shift of the midlines. The upper is not matching the lower, or so these small details, when you work on the finishing, sometimes it takes work. It takes work and takes time. And the patient, he gets annoyed by the treatment time. But it's a part of my personality. What can I do?
It's very important for parents as well, because maybe they bring the child to you just because they see aesthetically that the teeth are overlap. But then there is another issue, the functionality, and many other things behind that are very important to solve it from the beginning.
Yes.
So
True.
I really appreciate that you share this specific topic with the audience. What makes you different?
As I mentioned previously, we try to give the excellence to the patient, okay, as much as we can. So from the beginning, the diagnostic, good diagnostics, of course, the experience has a big role in this, and treatment planning, give a treatment planning. I try to focus on the treatment plan using the best system that I'm convinced with, and I found that I can give the best to my patients. And of course, I'm using all my knowledge that I took through the whole year, all these years, like from 25 years, even before, to improve. And there's a lot of cases that I was treating like 20 years back, and I wish that I can treat them back again for a better quality, because I learned so many things that I didn't apply before and I want to do now. And we continue like this. That's what I like. And when I see myself that I'm doing my best and I give all my knowledge to the patient, you can see that the treatment really, it's much better for the patient. The treatment goes much better than what you think. And
It's smooth.
that's what I'm trying. Of course, we have some difficulties that we face with so many cases, that there's a lot of factors that doesn't allow the treatment to go as it should be. I'm talking about normal case with all the conditions that can help you to go to the best outcome.
But how many cases did you treat so far? Have you
I
treated?
think I never counted this, but maybe over 7,000 case, 8,000
Wow.
case within 25 years. Yes.
A lot.
Yeah. I never make the accurate number, but I think over 7,500 or 8,000 case treated. Yes.
When someone actually know they need the orthodontic treatment, what is the moment when someone realize, yes, I need orthodontic treatment and comes to you?
We have two types of patient.